live stream, my amazing people. Let me add some light. Yeah, there. Yeah, so welcome in today's live stream, guys. Happy new week. And today is the last day of March, and tomorrow we are in April, guys. So welcome. Let's chill here. Let's learn together. Today we are discussing a topic on congenital viral infections. Okay, so welcome, like the live stream, subscribe if you're new, and make sure to engage and ask questions, drop your comments. Okay, yeah, it's just an interactive session. We learn together, we educate each other. So welcome, guys. Who is there? Who's the first one to join? I'm waiting, I'm waiting. I'm waiting. You know, we always start when we get 3 people, we start. 3 people, we start, guys. You also let me know if you've ever heard of these congenital viral infections. Yeah, share your experiences, or someone you've ever had that you know that has had these infections. Okay. Hey there, hey there. Hey, who is there? Hey, I'm counting. 1, 2, 3, 4. Oh my god. 5, 6. Yo, 2 people. Hello there, hello. Who has joined me? Who is there, guys? Thank you so much for coming around. Who is there? Who is there? Oh my. Hello. I think we will just start. Others will get us while we continue, right? Hey there. A minute. So guys, we've said our today's topic is congenital viral infections. What are these congenital viral infections, guys? What are these viral infections? Anyone who knows? Anyone to tell us about it? Anyone before we start? Am I still here alone? Hello, Mohammed. Mohammed is here. How are you doing, my good friend? So nice to have you here. Nice to see you around. How is everything with you? Happy New Week. Happy New Week. How is everything, Mohammed? Thank you so much for coming around, Mohammed. Hope today we're staying. I'm fine, but how are you? I'm also fine. I'm doing amazing. And I'm so happy to see you here. Okay? I'm doing great. Why are you not fine? What's happening? What's the problem? What's the problem, Mohammed? Too many things. I'm sorry. I hope you'll be able to figure out everything and you'll be okay, Mohammed. Okay? Yeah, I'm so happy to have you here. So happy to see you here, guys. So today, Mohammed, our today's topic is congenital viral infections. Have you ever heard of these infections? Have you ever heard of these congenital viral infections? My grandmother is in the hospital and exams, and I had to stop school. God, it's been mad. Oh, so sorry, Mohammed. That is so bad. I'm really sorry. I wish your grandmother a quick recovery. She'll get well soon. Okay? Everything will be fine, Mohammed. Don't worry. Yeah, you're welcome. You're welcome. Everything will be well. Soon, soon, soon. Okay? So I think we should start with our today's topic now. Congenital viral infections. So here we have a congenital, perinatal, and neonatal viral infections. Okay, so we see that intrauterine viral infections, we're looking at these intrauterine viral infections, and then perinatal and neonatal infections. So intrauterine viral infections include rubella, cytomegalovirus, parvovirus B19, varicella, and not varicella, and it's varicella, zoster, enterovirus, HIV, HTLV, hepatitis C, hepatitis B, Lassa fever, and Japanese encephalitis or phalitis. And then perinatal and neonatal infections, these are human herpes simplex, VZV, I don't know that in full, enterovirus also, HIV, hepatitis B, hepatitis C, and HTLV1. Hey there, who has joined us? Who is still here? Who is still here? Who is still here? Okay, we continue. Rubella, we start on rubella, the intrauterine viral infection. Okay, in rubella we look at the history of rubella. In 1881, rubella was accepted as a distinct disease. Then in 1941, you see, it started long time ago. Yana, how are you doing? Good night. How is everything with you? Thank you so much for joining. Kindly let me know where you're watching from. If you're new, make sure you subscribe kindly, and thank you so much for being here. Yes, today we're learning something, like we're just discussing about congenital viral infections to see what they are, how they came about, the effects and all that. So thank you so much for joining. Hello Yana, welcome too. Thank you. Yes, my name is Julie from Kenya. If you're new, kindly subscribe, okay? Thank you so much. So we're looking at the history of rubella. We see that it started a long time ago. In 1881, rubella was accepted as distinct disease. Then in 1941 was associated with congenital diseases by Greg. Hello, Sinkamiren. Thank you so much. Make sure you give me your likes, guys. Make sure you give me your likes and make sure you also interact. Tell me what you know as I tell you what I know. Okay? Sinkamiren, hope you're having an amazing day. Yana, kindly give me your likes too. Yeah, and then in 1961, rubella virus was first as isolated, not as associated. And then in 1967, serological tests were available now. And then in 1969, rubella vaccine was now available. The vaccine started being available in 1969. Okay. Yana, I'm from Kenya. What about you? Where are you watching from? I'm from Kenya. And then we look at the characteristics of rubella. Characteristics. Senkameren. You addressing Senkameren? I'm from Indonesia. Oh, okay, that's nice. Nice to meet you. Okay, make sure you subscribe. Make sure you give me your likes, Yana. So the characteristics of rubella, there is RNA-enveloped virus, members of the Togavirus family. There is a spread by respiratory droplets. In the pre-vaccination era, 80% of women were already infected by childbearing age. Those are the characteristics of rubella. And then there is clinical features. Clinical features of rubella. There is a maculopapular rash, lymphadenopathy, fever, anthropathy, up to 60% of cases in these. Okay. Looking now at the risks of thank you so much, my dear. I appreciate that so much. Then the risks of rubella infection during pregnancy. Okay. At preconception, there is a minimal risk. Not at preconception. Oh my God. There is preconception and there is minimal risk. Okay. 0 to 12 weeks infected, we see that 100% risk of fetus being congenitally, resulting in major congenital, spontaneous, okay, congenital, okay. There is abnormalities cases, and these are results also in major congenital. 13 to 16 weeks, there is spontaneous abortion occurs in 20% of in 20%. 13 to 16 weeks, there is deafness and retinopathy, 15%. After 16 weeks, there is deafness, by the way, and normal development, slight risk, and retinopathy also. These are the risks of rubella infection during pregnancy. Okay. And then we look at the congenital rubella syndrome. Thank you so much, guys, for the likes. As you come in, like, subscribe if you're new, okay? And make sure you engage here too. If you've ever heard of these congenital viral infections, or if it's your first time, you can still chip in and we discuss together, okay? There is congenital rubella syndrome. Here, classical triad consists of cataracts, heart defects, and sensorineural deafness. Many other abnormalities had been described, and those are divided into transient, like short-lived, okay, permanent, and developmental. Transient, low birth weight, hepatosplenomegaly. These words, guys. Thrombocytopenic purpura, bone lesions, hepatitis, hemolytic anemia, pneumonitis, and lymphadenopathy, okay? There is also permanent stenosis. Here there is a sensorineural deafness, heart defects, and pulmonary valvular stenosis. Patient detects atherosclerosis, eye defects, yeah, and all that. Okay, those are congenital rubella syndrome. And then the outcome of this disease is a third will lead normal independent lives, a third will live with parents, a third will be institutionalized. Okay, the only effective way to prevent this disease, congenital rubella syndrome, is to terminate the pregnancy. Okay, that is the only effective way to prevent it, by terminating the pregnancy. Though there are some preventions, and we're looking now at the prevention. Prevention 1, there is antenatal screening. We see that all pregnant women attending antenatal clinics are tested for immune status against rubella. Okay, thank you so much for the love, Yana. Thank you so much. And non-immune women are offered rubella vaccination in the immediate postmortem period. That is prevention 1, the first prevention. And then there is another prevention, the prevention 2. We say that since 1968, a highly effective live attenuated vaccine has been available with 95% efficacy, okay? Universal vaccination is now offered to all infants as a part of MMR regimen in the USA, UK, and a number of other countries, okay? Some countries such as the Czech Republic continues to selectively vaccinate schoolgirls before they reach childbearing age. Both universal and selective vaccination policies will work, provided that the coverage is high enough. The coverage, not coverage, the coverage is high enough. Okay, so we see that despite it like not having most effective ways of prevention of like healing it or something, there is some prevention measures that can be taken. So looking at the, is this one even necessary? No. Okay, now that is all about rubella. Okay, There is laboratory diagnosis. That one you guys can check it up if you're more interested, you want to know more about that. Okay, now let's look at Cytomegalovirus. This is another congenital viral infection. Okay. So this one is a member of the Herpes virus. You guys know Herpes, right? This is a member of Herpes virus, Cytomegalovirus. Primary infection usually asymptomatic virus, and then becomes latent and is reactivated from time to time. Okay, transmitted by infected saliva, breast milk, sexually, and through infected blood. 60% of the population eventually becomes infected. In some developing countries, the figure is up to 95%. Okay, so we see that this cytomegalovirus can be transmitted by infected saliva, okay, breast milk, sexually, and through infected blood. Okay, so it's congenital infection, defined as the isolation of CMV from the saliva or urine within 3 weeks of birth. Commonest congenital viral infection affects 0.3 to 1% of all live births. The second most common cause of mental handicap after Down syndrome, and is responsible for more cases of congenital damage than rubella. So we see this one is responsible for more cases of congenital damage than rubella. So this one is more dangerous. Okay, transmission to the fetus may occur following primary or recurrent CMV infection. 40% chances of transmission to the fetus following a primary infection. May be transmitted to the fetus during all stages of pregnancy, and no evidence of teratogenicity, that is a capability of fetal malformation. Okay, so there is no evidence of that damage to the fetus results from destruction of target cells once they are formed. Who is stuck? Who is stuck up to there? Up to there. Any question? Anything you guys can add up? Anyway, let's see cytomegalic inclusion disease. Here we see that CNS abnormalities. There is CNS abnormalities. That is the first disease. Microcephaly, mental retardations, spasticity, epilepsy, periventricular calcification. And then there is eye. In eye there is optic atrophy. Atrophy. Here there is sensory neural deafness. Okay, liver. There is hepatosplenomegaly and jaundice, which is due to hepatitis. Lungs, there is pneumonitis. Heart, myocarditis. Thrombocytopenic purpura, hemolytic anemia. There is lead coli, that is abnormal condition resulting from previous conditions in the individual, asymptomatic at birth. Hearing defects and reduced intelligence. Okay. Diagnosis of this cytomegalovirus. On diagnosis, there is isolation of CMV from the urine or saliva of the neonate, presence of CMV 1 gram from the blood of the neonate, and there is detection of cytomegalic inclusion bodies from affected tissues. But this one is rarely used, okay? There is also management of this disease, and this is how it is managed, okay? For primary infection, consider termination of pregnancy, okay? That is under management. 40% chances of the fetus being infected, and 10% chances that a congenitally infected baby will be symptomatic at birth or develop sequelae later in life. Therefore, in case of primary infection, there is a 40% chance of giving birth to an infant with a CMV problem. Recurrent infection. Termination not recommended as risk of transmission to the fetus is much lower. Okay? Antenatal screening. This is impractical, and then there is vaccination may become available in the near future, but currently there is no vaccination. Okay? And then another disease is neonatal herpes. Neonatal herpes simplex. You guys have heard of herpes, right? Anyone who has heard of herpes? Herpes. Anyone? I know you guys know herpes. Neonatal herpes simplex. And this neonatal herpes simplex, there is 1 and there is 2. Okay, so we're looking at neonatal herpes simplex 1. Incidence of neonatal herpes simplex 1 infection varies inexplicably from country to country. For example, from 1 in 4,000 live births in the US to 1 in 1,000 live births in the UK. Okay, the baby is usually infected perinatally during passage through the birth canal. Okay, premature rupturing of the membrane is as well recognized risk factor. The risk of perinatal transmission is greatest when there is a florid primary infection in the mother. Okay, there is an applicably smaller risk from recurrent lesions in the mother, probably because of the lower viral blood and the presence of specific antibodies. And then the baby may also be infected from other sources, such as oral lesions from the mother, or a haptic witch law in a nurse. Okay, that is all about neonatal herpes simplex 1. And then we have neonatal herpes simplex 2. Let's now look at these. So here in neonatal herpes simplex 2, the spectrum of neonatal HSV infection varies from a mild disease localized to the skin to a fatal disseminated infection. Okay, infection is particularly dangerous in premature infants, and where dissemination occurs, the organs most commonly involved are the liver, adrenals, and the brain. Where the brain is involved, the prognosis is particularly severe. The encephalitis is global and of such severity that the brain may be liquefied. Okay. A large proportion of survivors of neonatal HSV infection have residual disabilities. Acyclovir should be promptly given. This is a sort of medication, okay? Should be promptly given in all suspected cases of neonatal HSV infection. That is a neonatal herpes simplex, okay? The only means of prevention is to offer, oh my god, this name I can't read it. Caesarean, or yeah, Caesarean or Caesarean section to mother with a florid genital HSV lesions. Okay, that is the only means of prevention. So we see that neonatal herpes simplex 2 is like it's more dangerous than neonatal herpes simplex 1, but all in all they're all dangerous and there is no permanent cure, maybe in the future. Okay. And then there is another disease which is parvovirus. Anyone who has heard of parvovirus? Anyone? Have you guys heard of parvovirus? Anyone who has heard, to let us know. So on parvovirus, we see that a causative agent of fifth disease, clinically difficult to distinguish from rubella. Okay, also causes aplastic crisis in individuals with hemolytic anemias, as erythrocyte progenitors are targeted. Okay, spread by the respiratory route. 60 to 70% of the population is eventually infected, and 50% of women of childbearing age are susceptible to infection also. This is all about parvovirus. And then we have another disease here, congenital parvovirus infection, or still congenital parvovirus infection, known to cause fetal loss through hydrops fetalis. Okay, there is severe anemia, congestive heart failure, generalized edema, and fetal death. No evidence of teratogenicity. And then risk of fetal death highest when infection occurs during the second trimester of the pregnancy. Minimal risk to the fetus if infection occurred during the first or third trimester of pregnancy. Maternal infection during pregnancy does not warrant termination of pregnancy. Okay, cases of diagnosed hydrops fetalis had been successfully treated in utero by intrauterine transfusions and administration of digoxin to the fetus. Okay. That is all about parvovirus, one of the congenital viral infection. And then another one is varicella zoster virus. Zoster virus. Okay, that is what we're looking at next. So on here we see that 90% of pregnant women already immune. Therefore, primary infection is rare during pregnancy. Okay, primary infection during pregnancy carries a greater risk of severe disease, in particular pneumonia. for the first 20 weeks of pregnancy, we see that up to 3% chances of transmission to the fetus recognized congenital varicella syndrome. Okay, so these are scarring of skin, hypoplasia of limbs, CNS and eye defects, death in infancy normal. Okay. Mm-hmm. So now neonatal varicella. On neonatal varicella, we see that this varicella can cross the placenta in the late stage of pregnancy to infect the fetus congenitally. Neonatal varicella may vary from a mild disease to a fatal disseminated infection. If rash in mother occurs more than 1 week before delivery, then sufficient immunity would have been transferred to the fetus. Okay. Zoster immunoglobulin should be given to susceptible pregnant women who had contact with suspected cases of varicella. Zoster immunoglobulin should also be given to infants. Those mothers develop varicella during the last 7 days of pregnancy or the first 14 days of delivery. Okay. So guys, this is all about congenital viral infection, and we've looked at congenital, perinatal, neonatal viral infections. These are rubella, cytomegalovirus, parvovirus, varicella zoster, enterovirus, hepatitis C, B. Yeah, though we've not talked about all the others. So I'm still going to explain further. We've just gone too fast. Still going to explain further. Up to there, guys. Anything you can add on? Anything from you guys? Question? Any question? Any concern? Anyone? Mm-hmm. So guys, just to do a little bit of explaining, we see that these congenital infections are infections that pass from a pregnant mother to her baby during pregnancy or delivery. Okay, these are congenital infections, and they can happen during pregnancy. That is a transplacental transmission. There is during birth, through the birth canal, and then after birth through breastfeeding. Okay, the infections can affect the baby's organs, brain development, immune system, and growth. So some babies may appear normal at birth but develop complications later in life. Okay, the reasons why congenital infections are like major causes, not reasons. Oh my God. Congenital infections are major causes of miscarriages. Okay, like when the mother has these congenital infections and they're pregnant, they these infections causes miscarriage, stillbirth, birth defects, intellectual disabilities, hearing loss, vision problems, and developmental delay. So most like doctors study these diseases mostly early, and do the diagnosis early to prevent like so that they can prevent them and save lives. Okay. Now there is the torch group of congenital infection, guys. We see that many congenital infections are grouped as torch infections. So torch, we see that torch stands for Toxoplasmosis. T, that is T. O stands for other infections. R, Rubella, we've looked at Rubella. Cytomegalovirus, Herpes simplex virus, okay? And other categories are like the ones that we've not even explained earlier. Zika, we have explained Zika virus. There is also HIV. There is varicella, that is zoster virus, that one we've explained. There is parvovirus, we've explained that one too. Parvovirus B19, hepatitis B, syphilis also. Okay, and we see that these infections are very dangerous because they can cross the placenta and infect the fetus. Hello, desert man from the village, welcome, so happy to see you. How are you doing today, desert? Thank you for coming around like launched. thank you for the likes, desert, and thank you so much for joining. Okay, today we are talking about very, very important topic here. Karibu sana. Okay, umaisikia hizi magonjwa, congenital viral infections, desert? How is the village? I have had few. Oh, okay, that's nice. At least you've had them. At least you can add something here to discuss, manze. That is so nice. Desert, it's not congenital, it's congenital. Congenital is congenital infections are infections that pass from a pregnant mother to her baby during pregnancy or delivery. Okay? So let's look at how the viruses reach the fetus. I confused with congestina, the box. Aki desert wewe. How can congestina be a virus now? Congestina is a person. Okay, how viruses reach the fetus? Transplacental transmission, okay? That is the first way. We see that the virus enters the mother's bloodstream and crosses the placenta into the baby, okay? For example, Rubella, Cytomegalovirus, Zika virus. This one passes, like they enter the mother's bloodstream and crosses the placenta into the baby. Okay, and then there is a perinatal transmission. This is where infections occurs during delivery. For example, Herpes simplex virus. Desert, you've heard of Herpes? Another one is HIV. Okay, yeah, those two. And then there is postnatal transmission. This is where infection occurs after birth. Postnatal transmission, for example, HIV through oh my god, HIV through breast milk. Okay. Blood is a highway to many diseases. Yeah, that is so true, Desert. Very, very true. Hepatitis I've had. Oh, yeah. It is very common, by the way. Hepatitis B, hepatitis C. Now let's look at the factors that increase the risk of these diseases. Risk factors include mother infected during early pregnancy. Those are the risk factors, and we said earlier, like if the mother is infected in early pregnancy, like the best prevention is to terminate the pregnancy. Okay, that is the only way to go about it, or else the baby will be affected. And then another risk factor: weak maternal immunity, poor prenatal care, lack of vaccination, poor hygiene, living in outbreak areas. And we see that the first trimester is the most dangerous period because organs are forming. Okay, that's why it's advisable to just terminate it before it's too late. Before it's too late. The biggest risk is taking risk. How is that? How is the biggest risk taking risk? Aje sasa. And then we also looked at the congenital rubella syndrome. People take risk and have unprotected sex. Yeah, and that is so bad because you can't, like, you never know if someone is sick. You can't like way using your eyes, you can't see someone and say they're okay or not, you know. So that is a very, very big risk. Hiyo ni risky, very risky. So risk is the big. Okay, Desert, I get you. That is so risky, by the way. That is what leads to all these diseases. So congenital rubella syndrome, the virus responsible here is rubella, okay, caused by the rubella virus. And this infection occurs if a pregnant woman gets rubella. The virus can pass through the placenta. There is effects on the fetus. It has effects on the fetus, okay, obviously. Common abnormalities are cataracts, congenital heart disease, deafness, intellectual disability, low birth weight, hepatosplenomegaly. Okay, all these features are the ones that form rubella syndrome. People also get tired of using protection, deadly exhaustion. How do you get tired of using protection, Desert? How do they even get tired of using protection? Huh? How? People get tired. So people get tired of using protection. You know, that is now the thing that brings all these risks. Mm-hmm. They can't choose. Oh, okay, okay. That is true, by the way. And then they don't want to get like proper medication, and that is what harms even the society. That is so true, Desert. By the way, I've heard of these cases. I've heard of some cases like these. Mm-hmm. Mm-hmm. Hi, Emmanuel Joseph. How are you doing? You're so much welcome. Kindly give me your likes. If you are new, subscribe kindly. Eti wakipewa hakuna dawa. That is what they say, Desert. But there is vaccination, there is medication. I got to go. Hopefully, I'll join you later. Okay, Desert, no problem at all. Thank you for your time. Thank you. Hey, Bintu, a minute, a minute. Hello. Who is still around, guys? Who is still here? How are you doing, Bintu? You're so much welcome today. So nice to have you here. Okay. So today we've been talking about those congenital viral infections, and yeah, we've seen the vaccination treatment, how they come about, and everything. Anyone who has something to add on that, guys? Anyone, 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 anyone? Hey there, hey there. Who is still here with me? I see 3 people. Okay, okay, okay. Manoj, how are you doing today? Manoj, long time. You're so much welcome. Thank you. Senka Miren, good night. Manoj, how are you doing today? Kindly like the live stream. Today we've been talking about some diseases also, Manoj, and you've not been here, so kindly whenever you get time you can rewatch to get what we were talking about. Okay. Hey, 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 hey. So guys, that is all about this topic about congenital viral infections. You've seen all those infections, we've discussed, talked about them all. Okay, you can check them up if you want like to know more, you're interested to know more. Okay. Yeah, so that's all on that. I'll end this live stream and then come back still live to discuss about other things. Okay. Yes, 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 still coming back live. So wait up, guys.